Welcome to the channel. This is a dive into one of the world's most devastating neglected diseases. Forget bacteria or viruses. We are talking about a microscopic worm that can silently destroy the bladder, the liver, and even the spinal cord. This is Schistosomiasis, otherwise known as Bilharzia, or the chilling name, snail fever. It is an acute infection that evolves into a chronic parasitic disease caused by a tiny flatworm called the blood fluke, which belongs to the genus Schistosoma. Etiology and species. Schistosomiasis is caused by 5 main species that infect humans. We group them into 2 primary categories based on where they settle in the body. 1. The urogenital form, caused by Schistosoma hematobium, which targets the urinary tract, including the bladder and the ureters. 2. The intestinal form, caused by the remaining species, Schistosoma mansoni, Schistosoma japonicum, Schistosoma mccongi, and Schistosoma intercalatum. These primarily affect the intestines and the liver, and less commonly, the brain. Transmission. How does this tiny parasite gain entry? When the infectious larval stage, called cercariae, are released by the snail into fresh water. If you wade or swim in this contaminated water, the cercariae will pierce your skin and enter your bloodstream. Life cycle. The life cycle is fascinating and requires 2 hosts, a human and a snail. The cycle begins when an infected person urinates or defecates eggs of schistosoma into a body of fresh water. These eggs hatch, releasing the first larval stage, called the myricidia. The myricidia then penetrates a specific species of freshwater snail. This is the definitive host where the parasite multiplies. Inside the snail, the larvae develop into countless free-swimming organisms called cercariae. These cercariae are the infectious agents. If you wade or swim in contaminated water, the cercariae will pierce your skin and shed their tails, becoming the smaller, more dangerous form, known as the schistosomula, plural schistosomulae. This schistosomula then enter your bloodstream and migrate, eventually reaching the portal system in the liver, the veins surrounding the intestine, or the bladder, where they mature into the adult worm, the schistosome, and begin laying eggs. The cycle then starts again. Pathogenesis. The adult worms themselves cause little harm. The true damage is done by their eggs. When the schistosome lays hundreds of eggs, many get trapped in the host's tissues. These trapped eggs trigger a massive immune system reaction, leading to the formation of granulomas, leading to further mobilization of more inflammatory cells. This clustering of inflammatory cells eventually gives way to fibrosis and scar tissue, and this scarring is what causes all the long-term, devastating disease. Clinical features. Acute features, pruritus or swimmer's itch, an early local reaction that occurs right as the cercariae pierce the skin. Katayama fever, an allergic reaction to the migrating worms, often characterized by fever, a dry cough, muscle pain, and marked eosinophilia. Chronic features, urinary schistosomiasis caused by Schistosoma hematobium. The defining sign is the passage of bloody urine, or hematuria, which is typically painless and occurs at the end of urination, known as terminal hematuria. This is often accompanied by dysuria, or painful urination. Intestinal schistosomiasis, S. mansoni and japonicum. Patients present with chronic abdominal pain and bloody diarrhea, or dysentery. The liver and spleen may become enlarged, a condition known as hepatosplenomegaly. Long-term complications. When left untreated, the chronic scarring from the eggs leads to severe, life-threatening complications. Urogenital complications. The scarring can lead to obstruction of the ureters, causing backup of urine into the kidneys, or hydronephrosis. Most severely, chronic irritation is a major risk factor for developing squamous cell carcinoma of the bladder, a deadly form of bladder cancer. Hepatic complications. The fibrosis in the liver can block blood flow, causing portal hypertension. This increases pressure in the surrounding veins, which can lead to the formation of fragile, swollen veins around the esophagus, known as esophageal variceals. If these rupture, they cause life-threatening bleeding. The resulting liver failure also causes fluid accumulation in the abdomen, known as ascites. Neurological complications. Although rare, eggs can be shunted to the brain or spinal cord, leading to seizures or spinal cord disease known as myelopathy. Diagnosis. Diagnosis begins clinically, requiring history taking and a physical examination to identify chronic symptoms. However, confirmation relies on laboratory and imaging findings. The gold standard is finding the characteristic eggs in the patient's urine or stool using microscopy. For active infection, we use serology to detect the body's antibodies and antigen detection to find molecules shed by the living worms. Imaging, such as an abdominopelvic ultrasound scan, is crucial for assessing long-term organ damage. Finally, newer techniques like polymerase chain reaction, PCR, can be used for highly sensitive detection of the parasite's DNA. Treatment. The good news is treatment is simple. The drug of choice is praziquantel. This drug is safe, highly effective, and widely available. It works by causing severe spasms and paralysis of the worm's muscle, which paralyzes the schistosome and makes it vulnerable to immune destruction. Prevention and control. Prevention focuses on 3 pillars: health education regarding sanitation, safe water practices and avoiding contaminated water, snail control measures, mass drug administration in endemic regions, and capital cooperation and local action. If you learned something from this lecture, please leave a comment, hit the like button, and subscribe for more educational content. Thank you for watching.